shall begin with Ikoyi Obalende LCDA, where the completion work at Ijeh Primary Healthcare Center was commissioned. Political leaders, residents, and stakeholders in the community were present at the commissioning of this facility. We have this coming up in this report.
Primary healthcare PHC centers are built to avail residents easy access to health care. Ijeh community is one of the communities in need of PHC in Ikoyi Obalende Local Council Development Area. To provide solution to this challenge, the previous administration in the council embarked on the construction of a PHC at Dolfin Estate. On assumption of office, the chairman of Ikoyi Obalende LCDA, Fuad Atanda Lawal, inspected all uncompleted projects, including Ijeh PHC. During the inspection, the chairman promised to complete the project within a short period of time. Residents, council staff, and well-wishers gathered to commission the facility. Senator representing Lagos Central Senatorial District, Senator Oluremi Tinubu, was also present at the occasion. Speaking at the event, the council chairman, Fuad Atanda Lawal, said naming the facility after Senator Oluremi Tinubu is an appreciation of a selfless service to the people of the district.
I believe that honor must be given to whom honor is due. And you all will indeed agree with me that the honor we have bestowed on our mother today, who is also the senator representing the Lagos Central Senatorial District, is very well deserved. This facility is named after a godly, tireless, selfless, hard-working humanitarian who has spent the better part of her life working to better the lot of humanity. Senator Oluremi Tinubu has dedicated her life to sustainable humanitarian projects, as we will see in the countless projects that she has initiated and still runs to date.
He assured of continuous quality service to residents of Ikoyi Obalende LCDA.
At this juncture, there are some key facts I want you to know about our health center. It is going to be a 24 hours run primary health center, 7 days a week, 365 days a year. No public holidays for the primary health center. We are committed to providing qualitative care at any time it is needed. There is a fully functional integrated maternity center that has the state-of-the-art equipment and very experienced hands to ensure that our women can give birth with peace of mind. Wards are retrofitted and doctors are always on call to attend to patients. A fully equipped ambulance with state-of-the-art equipment on site. Fully air-conditioned facility and generator sets to ensure comfort at all times. Equipped laboratories for tests to be carried out on site. A pharmacy to ensure that high-quality medicines are sold as per government regulations. This facility has been very well thought of and will cater for everyone in all segments of the society.
This facility, I was told, will provide members of the community access to comprehensive health care ranging from 24-hour patient care to maternity services. Health, they say, is wealth, and a healthy nation is a wealthy nation. I must also use this opportunity to implore you all to desist from self-medication and to take advantage of this health care facility. It is on this note that I commissioned the Senator Oluremi Tinubu primary health care to the glory of God and the benefit of the good people of the Ikoyi Obalende LCDA.
Guests present at the commissioning commended the Honorable Fuad Lawal-led administration for prioritizing quality health care.
This is what we have campaigned to our people when we're coming on board, that by the grace of God, if given the mandate to serve, we will serve them also. And this is what we are saying here today. This is for the people. And democracy is about government of the people, by the people, and for the people.
The assessment is up now, at this moment. Most importantly, the community where it situates now is the Dolfin community. And you know, we have a police barrack here where we have the low-level citizens and others. So most strategically situated here by the chairman. I commend him. This is exactly what we want now. Health is wealth.
It's a good one because number one, primary health care is the basic of all healthcare. It's a healthcare at the grassroots, and it's one that everyone can access. And that's, the goal of WHO, to make sure that there is healthcare service at the very grassroots level that is available, that is affordable, that is accessible. And where this is located is actually a very, very accessible place. And it's also going to be providing 24-hour service. So that means it's all around the day. People can come in at any time to access it, and there will be health workers available to attend to them.
With the completion of this facility, residents of Ijeh community can now have access to quality health care.
I feel humbled, and to me it's a privilege. And I think there's no way I could tell the chairman not to name anything after me. But it's been a community of a lot of people with common minds working together. And we've been like a family in Lagos Central. And there's no way if one does one, you can say no to the other. I thank the chairman for what he has done. And I pray that this, why I hate, facilities named after me, is because I'm always afraid of the standard. Will it be kept well? And I pray that, this health center will stand the test of time and continue to give a lot of good service delivery to the community.
Bringing good medical care to the people of the grassroots is one thing at the center of my agenda. Trying to see how we can help people, help citizens, help members of our community. In Ikoyi Obalende as a whole, there's no standard primary health center here. And we've had cases of people dying before they get to the hospital on Lagos Island. But what we've done here is a completely free medical center where people can come, access quality medical care. We have a fully functional lab, and this is going to run for 24 hours a day. We have a standard facility management unit, and not just in maintaining the property itself, but even the way doctors treat patients, the way they talk to patients, the way they attend to patients. So for everything that goes bad here, we are almost immediately replacing something. So this is our flagship because we want people to see that this is not like a random place. This is where anybody can come. This is where a bank MD can come. This is where the pepper seller on the road can come. This is where petty traders can come. This is where the oil and gas guys can come. So I've built this having in mind that I want it to be a state-of-the-art a primary health center where you can go for the basic things, malaria, typhoid, little sicknesses here and there, and that's what we've done.